Welcome back. You tuned into Mid Morning Talk, and I'm indeed Mariam Mia. And I'd like to read out a letter that I found on Instagram, and really it was food for thought for me. So let's just read this. It says, "It hasn't even been 8 months. Pardon. It hasn't even been 6 months since we started vaccinating people in South Africa, and I'm already tired." Tired of getting frantic phone calls from post vaccinated individuals who desperately want ivermectin to top up the immunity. Tired of getting phone calls from people I don't even know who have had side effects from the vaccine and are getting no joy with reporting processes set up, or worse, have no clue that there's in fact a reporting system. I'm tired of taking an extra long added history of symptomatic peaks, now having to find out if they were in contact with a recently vaccinated person on top of the possible positive contacts, because I'm seeing so many positive cases whose only contacts are recently vaccinated family members. I'm tired of explaining to post-vaccinated people who have to still wear masks and sanitize and social distance, and that nothing changes post-vax. You can still get COVID and still transmit. I'm also tired of having to make an attempt at informed consent after the fact when you're clueless of the basics. The vaccine is still in a trial phase, and I personally cannot guarantee that they or their loved ones cannot die of COVID post vaccine, or can anyone else stepped up to take responsibility should this happen. I'm tired of explaining to people to say they only took the vax so they can travel. Hello! The South African vaccine card is not recognized anywhere in the world that treats vaccinated individually unethically different for unvaccinated ones. So, you've been misinformed. There is a list of pro-vaxxers. Is there a list of pro-vaxxers somewhere? A list of people that promote vaccines, spread only positive information about vaccines, strongly encourage their patients, family, and friends to take the vaccine, and then are difficult to reach once the side effects or questions post vax. I want to refer all post vax queries to this list. And in the meantime, I am saying emphatically to all those who are even thinking about reaching out to me in desperation post vax, go back to the doctor who encouraged you to take the vaccine. Report same on the Med Safety app and call the helpline. Should you get no response, post same on Facebook, like how you posted your triumphant selfie when you got your vax. And finally, to all those still thinking about the vaccine, I say this: once it's in, you cannot get it out. And this was written by Dr. Naseeba Kathrada, and I have her joining me here today on Mid Morning Talk. Assalamu alaikum, Dr. Naseeba, and welcome to Mid Morning Talk.
Walaikum salam wa rahmatullahi. Thank you for having me.
It's a pleasure. So I read this, and when I read this, I think on Friday, I could feel your frustration. Your frustration was tangible, and yes, there are many, many concerns out there. So while I hear this all even on. I was driving to the studio, and I heard on one of the radio stations how the people called in and saying, people need to vaccinate because they're being irresponsible for those who have vaccinated, and the debate goes on, and everybody is just pro vaccination, but they don't give you the facts. So tell me, like you say, after the effect, people are calling you. Why isn't there an education surrounding vaccines, proper information regarding side effects, and proper support? Why is there the lack of support regarding this vaccine?
Well, first, Mariam, I want to clarify that letter that you read out. It actually was a post that I wrote on my group. I am part of a group called Caring Healthcare Workers Coalition. We are a group of doctors that are fighting for our patients' rights and we want to put our patients first. So it was something that I wrote on the group, and of course, one of the doctors, one of the members forwarded it to another group, and that's how it went viral, and that's what happens with social media. But so just the clarity. So my name wasn't put on it, and whenever I write something for a public forum, I always put my name on it. I didn't mind that it went out viral because that is exactly how I felt, and that is my opinion. So when it comes to the question that you just asked me now, I just want to read something out to you. This is directly from the South African Medical Association website. Actually, it's their definition of informed consent. It says basically informed consent means that sufficient information is provided to the patient to make an informed decision, and that the patient actually understands the information and the implications of acting on that information. Informed consent relates to a person's rights to human dignity and autonomy. And this is very, very important, because this is what I was trying to highlight, to say that those of us who spend time giving the informed consent to our patients, we are the ones who look at all angles. We look at both sides. We know that the vaccines are in a trial, but many times that simple fact a patient will not know, because they'll call me and they'll say, "Oh, I really want to take some ivermectin because I need to have my immunity boosted." Then I go, "But why do you want to take ivermectin if you've had the vaccine?" They go, "I'm not sure that the vaccine is going to work." "Why did you take it in the first place?" "Oh, my doctor said I should take it." That's not enough information. If a person is so unsure that the vaccine is going to really work, why would they need to take ivermectin? So my issue was around the fact that this informed consent is so important, especially because the dynamics of this pandemic is so fluid. Things keep changing. Recently, in an interview, there was a doctor, I think it was on Channel Islam, started off somewhere in the interview saying that vaccines are 100% effective against death. As that interview continued, she said it was 90% effective. Then she said it was 95% effective. Now, we are very quick to jump at the doctors who are cautiously advising their patients because they're labeled as anti-vaxxers. What about those doctors who are making false promises? Isn't that misinformation as well? And shouldn't we caution? Don't doctors have an ethical responsibility to give correct information? And do not blame the doctor for giving 3 different stats in one interview. It's because things keep changing. But like you said, there's this whole scenario where it is not, the people are not being informed about it, and that is my concern as an individual. And I'm very sure that our entire group of doctors, which is the Caring Healthcare Workers Coalition, all have the same concern. We are by no means anti-vaxxers. We are saying that when you take the vaccine, the person who is encouraging you to take it should give you all the facts, so you don't end up phoning another doctor to try and get information once you've already taken the vaccine. And that's what my post was about.
Yes, so I'm one of those individuals that whatever I do, I like to plan before, because even in Islam, it's always that's a mindset, and our way of life is always to take your precautions, to be
Yes.
informed before going away, go and doing something. I don't like to be that after the effect person, because I love what you said, because once it's in you, you can't take it out. It's too late. And also you can't do things. That's why when I make decisions, I don't like making hasty decisions. I like making informed decisions. And so I'm at the moment, I'll be honest, I'm a fence sitter in terms of the vaccine, because uh, I suppose the platform I am on, or I provide a platform to people. So I'm speaking not only medical professionals in South Africa, but also in Europe. We've interviewed in America in terms who have voiced the concerns regarding figures given out in terms of effectiveness, as well as in terms of how effective it's going to be, and also in terms of side effects. And also, this vaccine hasn't been tested across the board with people for every type of comorbidity. So I
Yes.
need to have facts and figures. So that's how just I'm wired. So at the moment, I need to make an informed consent. But I feel now I'm being labeled as an
Yes.
anti-vaxxer. So I don't like this label. I want to make, so I'm not saying I'll never take the vaccine. I am still debating. I want to
Yes,
get all the information. I need to see my body. My body is in amana to me. And I need to know, I need to make a responsible choice for me. I've
correct.
been
And
told
that is your
I'm being,
right.
so
And
I've
that
been
is your
told, so
right.
yes, so this is my dilemma at the moment. I've been told I'm irresponsible because if I don't take the vaccine, there's not going to be the immunity, and I'm going to put all those who have taken the vaccine at risk because the virus will mutate, and this is on me. So I'm being labeled as
Anti-vax.
irresponsible at the moment. Well, then anti-vax, I'm irresponsible. The vaccine is safe, and this is not even my medical professional. So now everybody's laymen have become medical authorities on
Yes.
the vaccine now, and we have people that are becoming the face and ambassadors of vaccines just because I don't know, it's fashionable to do this, or they think it's their social responsibility to encourage people to go and get. So it's even enticing them. So I'm just very confused, and that is why I took comfort in your post because it made me realize there's nothing wrong with me wanting to take my time and decide whether or not I want to be vaccinated. Do I have enough information to vaccinate or not? Am I correct in my uh, not being
Thoughts.
hasty to go in my thoughts and not being hasty
Yeah.
to vaccinate?
Well, 100%. See, if you look at misinformation, right? Misinformation is getting information that is false or inaccurate. If we are in the middle of a trial, we haven't yet identified what the correct information is. Trial phase means that we are still learning about it. So if you are one of those people that wants to learn more about this particular which is COVID and the vaccines, you have every right to because we are in the trial. But you also have a right to know the information as it is coming out. In fact, I do my own channel called Hello with Dr. Cat, where we chat to general people, public, and we have a conversation just like you or I. I've done about 9 episodes, and 3 of those episodes have been censored just because I was talking to another doctor. And I find that so bizarre because a person's opinion, regardless of whether they are a doctor or not, should count. And yes, a doctor speaks with authority, but when it comes to this particular vaccine, there is no, if you go to the NICD website, if you go to the Pfizer website where they give you the information, it clearly states in about a paragraph at the bottom, emergency use access, they don't have enough information. Pfizer themselves admits to that. So if they're telling you that and we are discussing what the outcome is going to be, why censor us? Why not allow us to have the debate? And just like you, I didn't say I'm not taking the vaccine. I said I'm not taking the vaccine now. And that means I want time. I want time to make an informed decision, and that is my right. I've also found out recently by speaking to MIRIC, an organization which is my right to informed consent, that even if you are undergoing a general anesthetic for a procedure, you can be in theater, having signed all the forms, lying on the table, ready for them to put the mask and anesthetize you, and you can say, stop. I've changed my mind. That is your right. It's for exactly the same with the vaccines, where you can be sitting in the queue, you went through the whole process, and then you ask a question, and the vaccinator doesn't give you an appropriate response or something you're comfortable with, you can say, stop. I've changed my mind. And you can obviously come back another time, but that is your right. And my concern is that we are censoring people for informing people about their rights, and we are censoring people for robust discussion. And this is the time for discussion because once you take the vaccine, it's too late. My other concern is regarding the side effects. I remember when I was at medical school, there was a textbook written by a man, and it had minor disorders of pregnancy and major disorders of pregnancy. So major disorders of pregnancy are eclampsia, high blood pressure in pregnancy, etc. Minor disorders were nausea, vomiting, and backache. And I remember when I was pregnant, and I said to myself, yo, this backache that I experienced, there is nothing minor about it. And I had hyperemesis gravidarum, so I threw up for like 6 months, and that is a minor disorder of pregnancy. And I'm thinking, who decides what is minor and what is major? And when a lot of people associate a side effect or a reaction They will think, I took the vaccine, immediately got a rash, hives, rushed emergency, that's a side effect. I took the vaccine and 10 minutes later I died, that's a side effect. No, it's not. If you take the vaccine and something changes in your life, whether it's you start getting headaches, whether you've got high blood pressure, whatever it is, we need to know whether it's associated to the vaccine or not. And I am concerned about the transparency regarding that process. If you go to the NICD website, it is done. I was actually looking at it this morning before I came on air. There's excellent information about what are side effects and how to report it. However, just like you said, when you look at the media and the way it is being it's been portrayed, it is a safe vaccine. It is your responsibility to get vaccinated. You are saving other people by getting vaccinated. Now that is a media campaign, and that is shocking because under emergency use access, section 21, advertising for an aid for a therapeutic under emergency use is not allowed, and that is on the SAPRA website. I have sent an email to SAPRA. I'm waiting for a response, asking them how come you look at ivermectin under section 21 process, which is the same process that the vaccines are supposed to be undergoing. Why do you look at it with a completely different
So,
microscope? So to say?
Dr. Kathrada, that's what I needed to understand because, today also, so I feel I'm putting myself out there because, first of all, I've made it now public domain, my views regarding the vaccine, because, for 2 weeks now, I've been having debates and I'm now labeled, even in family circles, in friend circles, as this community leader, as this presenter person out there, but yet I'm now an anti-vaxxer and they can't understand somebody who's so progressive as myself has these views and reservations of a brown breaking vaccine. And I've been having all this, so I'm really grappling with this, and I felt, you know what, today is the day I'm going to be brave out there, and I'm making known my views. But I just want to say, I've got assalamu alaikum, beautiful ladies. Are you saying we should take the vaccine or not? But I'm going to read this, but you can just keep this. We can respond to this. Kashifa Pandey says, making claims about a trial but no accountability or liability makes no sense. Trevor says, when you tested positive, after how many days can you vaccinate somebody 30, 35, 42, 90, which is correct. So, I mean, just from these comments, people are so confused. You can read there. I mean, your questions were post-COVID, but even so, people are struggling with this. So that's exactly, look, I had COVID in February. I came out saying I took ivermectin. I was in awe of you. I think for me, I put you up there with the Charlotte McClackes, the Helen Suzmans of this world, and that because I think you're visionary, you're brave, you're courageous. I mean, every time you challenge SAPRA, you could have health professional council looking at you under scrutiny, maybe waiting for you to air to revoke this. I mean, you are well aware of your risk in terms of being vocal, and many doctors took the silent approach in terms of supporting their patients with ivermectin, but not being out there because so when I took ivermectin, my physician, the first thing when we messaged and I said I'm positive in that, he said, do you have access to ivermectin? And then I remembered that list of all the doctors who put my name, and he certainly wasn't there. And he's a senior doctor, and I was thinking to myself, but why didn't so many doctors who were prescribing ivermectin to their patients and giving to them put their names here? And that's when I realized how brave the doctors who actually put their names behind the support of ivermectin were, and at what personal cost and risk to your own careers you have done. But that's what SAPRA says. Ivermectin didn't pass their gold standard of in terms of tests and trials in this, and that's why for South Africa it's not safe. But then why? Maybe make me help me to understand, this vaccine past all the various trials that it needs to be done? Because I read about smallpox and I read about the process that that vaccine had to go, and how many years it took before it was there, and also what a process it was before smallpox was all but eradicated from society, right? So I need to know, for vaccines, is there a different trial process than medicines? Because I'm a layperson and this is going to help me with my inform thing. And if it's experimental, then why are you pushing everybody? And also, if there's no proper reporting, then if you choose to be part of this major global experiment, then why isn't there a process where your data is being analyzed? So everybody who has side effects, where's that correlation of data? I mean, I've studied research at it when I was doing psychology, and I understand research 101 in terms of making sure that you have data inform all the ethics behind research. So is this a bit different? And is this immunity? Are we,
Um,
so just help me understand this for myself, and I think all those who are struggling in terms of understanding this.
Okay, so yes, your concerns are very legitimate, and I also think that you are very courageous. But the thing is, we have to remember, if you look at the last letter that I wrote to the president, where I took it off and I said, "Dear fellow South Africans," I was saying to them that watch what's going on and be vigilant, because if you look at the vaccines and the way it's being rolled out, the minute it starts becoming mandatory to take a vaccine that's still in trial or whenever, we're going to lose our liberty. And that is my concern. And that is why I am so concerned about this informed consent that's going on, because it is your right. And when people start getting shamed in public and called irresponsible, it puts the rest of the public back into that confused state, and then they get fear, they get afraid again, and then they stop asking questions. And it takes somebody like you who's well read on both sides. It doesn't mean that you're going to avoid looking at the data. You're asking, show me the current data. If you go to Pfizer document, for example, at the bottom where it says emergency use access, it explains clearly that you only can continue vaccine rollout worldwide if there does not exist any other single treatment that is even shown to prove to be effective against whatever it is the vaccine is. So in this scenario, what that means is that if ivermectin was shown to work for COVID-19, you're not allowed to give the vaccines now. You have to wait until the process of 2 years, when it goes through its normal under the microscope, the data is collected, safety data is collected, people have been followed up timelessly, people have been followed up properly. You look at all the data, you collect it, it's peer reviewed, and then you say, yes, this vaccine is now safe and we can register it, no problem. So we can take treatment modalities, but there's also an option for the vaccine. That did not happen for this vaccine because it's under emergency use. And I also want to clarify, you said that SAHPRA does not recommend the use of ivermectin. Do you know that SAHPRA does not recommend vitamin C either? Do you know that SAHPRA does not recommend steroids? Do you know that SAHPRA does not recommend cough mixtures for COVID? Do you know that, not SAHPRA, the NEMLC, which is the Essential Medical List Committee, they are the ones who make recommendations. In fact, an antibiotic like Zithromax is strongly not recommended. So ivermectin is not recommended. Then you get moderate, and then you get highly recommended. But the category before that is strongly not recommended. That means that there is nothing, not remdesivir, not vitamin C, not antibiotics, not anything. None of them is recommended by SAHPRA. And that will tell you exactly what I just said. You're not allowed to recommend anything because, sorry, ma'am, my iPad's about to die. I'm going to move it. No, just wait there. So basically, they're not allowed to recommend anything, because if they recommend one thing, then you're not allowed to give the vaccines right now. And that already should tell people, the doctors out there, the scientists out there, that already tells you something. And shouldn't you not be alert to that fact? Why are we spending so much of our effort on the vaccines and on the 98%? I mean, we know that the survival rate is actually 98, 99% with COVID. I mean, you've had COVID, so you now have a level of natural immunity. Why are we focusing on those people? Let's focus on the 2%. And then you start thinking about it economically. Should we spend billions of rands on 2% of the population? Is that going to be lucrative? Or should we now think about spending billions so that we can make some money of the 98% who are on the other side? And then you start asking the question that you are asking. Get the extension. So basically, that's the issue right now. And that question that was just asked, somebody said, "Do we recommend you and I?" I can tell you from my opinion is I am not saying don't take the vaccine. I am saying know your rights, ask the questions, and if in your heart you feel that that is the right decision for you, no problem. I am not anti-vax. I am pro-choice. Pro-choice means give me a right to take ivermectin because it's my right. If you don't want to take it, no problem. Same story. If I want to take the vaccine, let me take it. If you don't want to take it, you don't have to take it. Don't force me like I won't force you. Respect my decision like I respect yours. You made the responsible decision to take it for yourself. Let me make the responsible decision that I think is best for me. Don't call my information misinformation. How do you know that your information is not misinformation? And there's nobody at this point, that can say 100% that the vaccine is safe. I mean, Allah Ta'ala has warned us about hypocrites. And that is for me, that the glaring thing right now is how can a doctor sit there in front of a patient saying that this vaccine is safe? Clarify your statement. Say, I don't know anybody who's had side effects. Or, up until now, we know that the vaccine is safe. But you must say that with conviction and truth and know that you're answerable to the Almighty. Because I can tell you that even a very good friend of mine who's taken the vaccine has memory issues. And this is one person I'm talking about. I know many. I'm talking about one. And she herself has admitted it that she's got memory issues because of after taking the vaccine. Is it directly related to the vaccine? I don't know. Is it a psychological thing because she's scared that she may get side effects? I don't know. But the mere fact that her life has changed after taking the vaccine, where she makes a list for everything now, means that for me is that I have to tell that to my patients. I have to inform them that this is basically what you have to know before it. And then put it in. So I'm
Okay.
saying that you have to. It is your responsibility to give your patients all sides. And I want to just tell you one story before this. This is legitimately what happened and why I wrote that rant. I've got a patient of mine whose husband had COVID. He was very sick in December, and alhamdulillah, we got ivermectin to him. And since then, she drops off random things at my house, flowers and muffins, and just to say thank you because I helped them during that time. So we've got a relationship after her husband had COVID. She phones me the day that I wrote that post, and she was frantic because her mum was coming from Johannesburg to come and visit. Her mum's got terminal cancer.
Nasiba, I've got Kashifa saying without long-term data, how can we have the mandatory vaccines enforced in workplaces? And now we have businesses coercing people with discounts. Why is this allowed? And for me, this is a constitutional issue.
Okay, so a business is allowed to give incentives. They're not allowed to enforce it. There's two different things. So that's exactly what my letter said. Be vigilant, because it's the same. It's two sides of the same coin, right? So as soon as a business or your boss enforces it or forces you to take it or threatens that you're going to get fired, you can take that up. We've got lawyers standing by because that is not allowed. The president has said many times, the Minister of Health said many times, nobody will be forced to take the vaccine. So if your company says you're going to get a bonus or you're going to, unfortunately, they are allowed to do that, but you need to see past it. Is the bonus worth it? And also, if a company is making efforts to have you vaccinated on their premises, they are taking responsibility for any side effects. So you make sure that you get it in writing. If your boss says take the vaccine, otherwise XYZ, then you say no problem. If you want me to take the vaccine, I want you to sign this form. There are many of them out there. It clearly says that I'm taking the vaccine at my work premises. Pfizer has absolved themselves of liability. The government says that you need an investigation process. But if you are my employer and you're saying I must take the vaccine, I will take it on a signature saying that if anything should happen to me, you are responsible. Very quickly, most businesses won't sign that.
Yes, you see, this for me, as you said, knowledge is power. And I'm so pleased we're having this discussion because I was not aware of this, and I'm sure many of my listeners. So this is what I'm saying. Why? are there no forums such as this here, where we can get these informed decisions, where we educated about regulations, rules, so that this helps me in terms of making informed decisions. So that, and the other question is, in my entire history, uh, as a community person who works closely with medical professionals, as well as in academic, I've never seen such a debate, a divide amongst medical professionals that are pro and con. And also, I've seen articles where if somebody on this side of the debate is speaking about, so basically you saying informed consent and that, and then I'll ask somebody on the opposite side that, what, Dr. Kathrada has commented this, what is your comment? They then refuse to be uh, on that same platform, or to even be quoted in that same article. Why? Can you unmute your mic, Dr. Naseeba, if you can just, yeah.
Okay.
Okay,
So
you can go ahead.
basically, yeah. So basically, that's the thing, right? When I started off this conversation, I told you informed consent, and I said misinformation. If you look at misinformation, when you ask that question, you ask, and somebody with conviction says certain things to you, you tell them that you have a right to see the data and you want it proven. And that's the same thing with me. Is from the very beginning of this, I remember doing an interview on Salam Media and on Channel Islam right in the beginning of COVID, where every morning we would get up with stats. We'd get up with stats, and that means people are dying. People are dying, and I was very much involved with the PPE distribution, etc., around Durban, and I would drive when it was lockdown 5. And I promise you, with the amount of number that they were saying people were dying, should have been seeing people keeling over on the side of the road. But I'm not. And I saw a question just now that popped up where somebody said, what other alternatives they have? Do you know that it is your right for informed consent to ask that question to the person vaccinating you, to say, is there an alternative? Yes, there are 5 other vaccines. Why can't I get that one? Because it's not allowed in South Africa. But the mere fact that the vaccinator doesn't know that will tell you that they only are given a certain narrative, and they have to follow that. And if your person vaccinating you is the one who's not responsible for you getting any side effects, or if you get COVID and you die, then you need to find the person who's responsible and then take the vaccine from that person. And right now, the concern is that what if I die? And alhamdulillah, it's already been 18 months into the pandemic. I am saying that statistics have shown that the number of people that are dying are less than 2% from COVID itself. So ask yourself how many people around you that you know personally died from COVID. And then ask yourself how many people died of COVID and with COVID. So if a person had COVID today, and 2 months down the line they died of a heart attack, is it a COVID death? So I'm talking about specifically somebody who was on the ventilator, went from COVID, and then you can associate it directly with that. Count how many people there are. Then ask yourself how many people you know died in car accidents, how many people you know had cancer, and then have some perspective before you make the decision. And before you are scared, you have to look at what's going on, and the only truth that you know is what's happening around you. That nobody can deny. So whether I'm giving information, whether you're giving information, whether Dr. Fauci is giving information, whether Professor Shabir Madhi is giving information, that's fine. That's coming from the data that they're reading. But you as an individual want to see all sides, and right now the only truth you know is what's actually happening to the people around you. Because if you are concerned that the information is coming across is not really true, 100% you can verify with the people around you. And if you've had a lot of deaths in your family from COVID, or if you had people who've had the vaccine and have not had any side effects, then that's your truth. But if you know one person who had side effects from the vaccine, or one person who survived COVID, then that's your truth. So go with your truth.
Yes. So I have lost family members through COVID. I'm part of a oxygen team in my area in terms of facilitating, in terms of COVID support. So I'm really on a daily basis. I hear funerals, so I hear of people that have passed on COVID, and this is my truth. But at the same time, I know of plenty people who have been vaccinated, and I hear of the side effects from the vaccine. The first side effect for me was an aunt in the UK who took the vaccine already in March. She took the vaccine, and the next day, I mean, she was in her 80s, so see, and she's a perfectly healthy 80-year-old who could outswim myself and yourself as well as outwalk us. That's how fit she was. She took the vaccine, and the next day she suffered a heart attack, and she spent 2 weeks in the hospital, and nobody could tell her if there was a correlation between the heart attack and the vaccine. And that's what she wanted to know, because she had to go for a second follow-up in 3 months time. That time it was a 3-month duration, but everybody, she said, was pushing the goalpost. So her own doctor and physician said, no, you need to ask the people that you're going to vaccinate, the hospital. But nobody at that time could tell her about the correlation. So she was pro-vaccine at that time, and I mean, that's why she was one of the first people in the UK to take this vaccine. And then she was nervous about doing the follow-up, right? And then when it came home to South Africa, um, I had somebody who works at, who does my accounts in that for our business, and she then told me her father had passed away, and he had taken the vaccine in the first week of June, and by the end of June he had passed away, because after the vaccine, 2 or 3 weeks later, he had contracted COVID and he had passed away, right? So this was the reality. I have many colleagues, I had many family members who had the vaccine, were out for up to 2 weeks with COVID side effects and things like this. So yes, I'm seeing deaths. It's home, it's in my family, it's in my community, and yes, I'm afraid. And I mean, there is this option of the vaccine, but at the same time, I'm not convinced that taking the vaccine is going to give me the immunity I need. It's going to prevent me from contracting COVID or transmitting COVID, and it's going to alter my life. So yes, I've seen both sides. So I've got perspective in truth on both sides. But as you say, I don't have any reassurance. So I'm told, yes, you're going to get COVID. If you get the vaccine, you're going to get COVID. But Mariam, you're not going to be as sick as you were when you had the first time, where you were hospitalized, where you had COVID pneumonia, where at one stage you were even asking yourself, uh, are you going to love, or you were praying your kalimas? Because I was at that stage. And they asked me, do you really want to go back to that space and that place? The vaccine is not going to let you go to that space where you're going to get so ill. But is it really going to get me? Can people tell me that I won't go to that place?
That's exactly the point. And I'm so glad that you shared your story. So, one of the stats you need to do is, like you said, you know people who died from COVID, and you know people who, like you yourself, have suffered. You need to make a list of how many people you know that survived COVID. And that's the thing we keep missing. We keep telling the stories of the death. What about the survival? I mean, when we have people who've had flu or whatever it is, you know, we don't start counting how many people die. We don't. It's only happening with COVID. But I'm so glad that you went through your scenario. And my suggestion is that you, as an individual who have doubts about the vaccine, but Allah has given you, you've had your natural immunity and you've survived it, you need to do research on natural immunity. And you need to check your antibodies. And Alhamdulillah, as long as you have antibodies, we know full well that they keep telling us that we can't say whether your natural immunity is going to last. If you can't say if your natural immunity is going to last, which we know about for years, centuries, how can you tell us that the vaccine immunity is going to last? So even if the vaccine is 100% effective against death or 90% effective against death, for how long is it effective? They can't tell us because they don't know. And why don't they know? Because you haven't waited 2 years. You haven't waited the time to check. So I am very interested to know if you've got vaccine COVID antibodies. And if you do, and somebody in your situation, my advice to you would be to do your research on that, on natural immunity. And that is your informed consent, because you're in a different category of people. And if our country has shortages of vaccines, like they say they are, and we're trying to roll it out as fast as possible, then why not do some research on natural immunity and let that category of people wait? Why would you vaccinate somebody who already got antibodies when you're leaving a whole kettle of people, a category of people without any? And that again doesn't really make sense, because it takes one test to check. I can do it in my rooms. It takes 15 minutes. We can check if you've got antibodies. And then you can say to the patient, listen, you don't have any antibodies. You in that category that needs to be doing different informed consent. And my thing out there, and my message to everybody out there, and I keep saying it over and over again, is that we are in an age where information is at our fingertips. The problem is, how do you decide what is misinformation and what is information? So on a daily basis, I put it on my status regularly. I pray to the Almighty that my truth, I said, Ya Allah, please make my truth be the truth and keep me away from falsehood. And if I make that dua on a daily basis, I can promise you the days where I'm wavering and somebody will send me a message, I get called psychotic and I get called irresponsible and I get called names on social media. That is the day that Allah will send me. I promise you, somebody will phone me and say, please, can you help me? My mother is vaccinated, but I think she's going to die. So I go, but why do you think so? Oh, because I may be giving her COVID. I said, but if she took both the vaccines, why are you still concerned? And then I do that and I go, see, there's the message. People are not getting the correct information. The path that I've chosen, that still feels right to me. And I will continue fighting for the truth because I want to make sure that my truth is the truth. And no matter what they can do and come at me and call me irresponsible, my obligation is to my patients right now. And the exclusive judgment is the exclusive right of the divine. And Allah has given us all talents. He's given us one body. He's given us all voices, and we will be responsible. In the day of Qiyamah, you will ask us, I gave you that talent. What did you do with it? And if my talent was to be outspoken, and if my talent was to get this message across and I didn't use it, he's going to ask me that, and I'm going to have to face him. And that is my concern.
So before I let you go and we round up, I've got a question here. Is it safe to take paracetamol before receiving the COVID-19 vaccine? Any experience and thoughts on this?
Okay, somebody asked me that in the group. So Panado is very safe. So the question is it safe to take Panado? Yes, Panado is very safe. We know that. That's around for hundreds of years. So you cannot, if something has to happen to you after the vaccine, yes, you almost 100% can say it's not because of the Panado. If anything has to happen to you, I know a lot of people are saying that when they vaccinate their kids, etc., they always take Panado before and it always helps them. Yeah, no problem, because it'll help you if you have mild fever or with the pain on the vaccination side, yes. So Panado, no problem.
Okay. And then I've got this other, is it safe to take the vaccine when you are pregnant, HIV positive? Yes, so if you're pregnant or you're HIV positive, what if trials said regarding pregnancy and HIV positive patients in the vaccine?
Okay, so with regards to that, I've read articles both sides, and also it will be, there are articles that show that people get more severe COVID if you're pregnant, and then there are articles that show that a lot of babies, I think there were 46 spontaneous abortions in one study where people took the vaccine. So that person who wants to know more about that, they should go to the NICD website, specifically look up pregnancy and vaccine, because I think depending on the vaccine that you're taking as well, depending on the trimester, and depending on any other illnesses that you have, I will not make I will not advise either this way or that way. My advice again is you need to do your research, because your scenario is not just that you're pregnant. Which trimester are you in? Do you have any other comorbidities? Have you taken other vaccines before? Do you have any other anaphylaxis? Do you know enough about the vaccine? Are you taking it because of work? Are you taking it because you want to protect the baby? All of those questions need to be answered, and you should discuss that with your doctor.
And regarding HIV positive
Exactly the same thing.
individuals?
I can tell you in my personal experience, I noticed that people who are on antiretrovirals, alhamdulillah, do very much better with COVID, because it is a viral illness. So I haven't, this is personally, right? Not from a study, my own experience is there is some sort of protection from COVID if you are on antiretrovirals. I haven't seen anybody vaccinated who is on antiretrovirals. So I am not talking about data I've read. My own personal experience, I see protection in people who are on antiretrovirals already.
I could chat to you for hours, because I just feel you're so good at this is your gift and this is your forte in terms of guiding us. So you're not telling me take the vaccine, and you're not telling me don't take the vaccine, but you're providing me with information that is going to allow me to make an informed decision and which way to go. So I could have for me the antibody thing was a new thing which I did not think about in terms of test yourself and that. So I think for myself and your listeners, you've provided us with so much information in terms of arming ourselves to do this. And I'd like to say categorically on air, I'm not against the vaccine. inshallah, I make dua that in 2 years' time, this vaccine is a success. And yes, once it's proved to be a success, like all other, whether it's polio vaccine, the rubella vaccines that we take when we are young children to prevent our babies from getting German measles. I mean, when you take that vaccine, you are told, this is it, against polio, against rubella, whatever it is. I mean, you take your yellow fever vaccine when you're traveling to give you that immunity. So we make dua, inshallah, that this vaccine proves to be successful uh, against the fight for COVID. And or even it needs tweaking, and they come out with a improved version, because that's what medicines always do. You find, I mean, first of all, we used to have antihistamines that you make you extremely drowsy. And now is that just came off the cuff of my head, as a hay fever sufferer. And now, I mean, you get even the Damazons, whatever, it's no drowsy now. So medicines are evolving,
Some of them
and
make you
they're
fat
improving.
also, Mariam. So, and that people didn't
I
know.
didn't need to know this fact. That's what I
I'm
would
just
like.
saying. No, I'm just saying.
Yes.
And we know that now because it's around for such a long time. I've got a patient who picks up 40 kilos taking an antihistamine because you're taking it every day. I just switched it to another one. But exactly what you're saying, we will need to wait to know the data. And I'm fully committed to doing this with you once a month. I'm happy to do this with you where we can have an engagement, a discussion, so we both catch up with exactly what people are feeling, because that is your responsibility, and you are doing it beautifully where you give people, we must empower the people, and we empower people with knowledge, but we have to also empower them to let them know that there are people on both sides. We are all in the same storm, but we are in different boats. So your boat is not the same as mine, but we're all in the same storm, and we all want the same thing. We want ultimately to save lives, and we want ultimately to get the correct information out there. And I made a comment once on a group, and I said, you know what, I'm so glad that there are two sides, and the people who are taking the vaccine and the people who don't, because in the event that we are incorrect and haven't taken it, then there are people who've taken it and alhamdulillah, they survived in 2 years' time. But in the event that we are right and something's going to happen to everybody who's vaccinated, Allah forbid, but that means there's another group. Can you imagine if everybody takes the vaccine and then there's a problem? Or if nobody takes it and then there's a problem? Should we also not look at it logically? And then I got labeled Flat Earth Society. Somebody said, no, I'm talking like the Flat Earth Society.
So I need to be prepared of the backlash I'm gonna get. But you know what? It's my right. It's my body. It's my imanat, and I did not say that I'm anti-vax. I'm not taking. I want to make an informed decision, and I think it's everybody's right. And also those that are non-medical personnel that are just pushing you to take the vaccine because they vaccinated and they've been told you're going to be a risk to them, or this vaccine won't work in terms of immunity and in terms of eradicating or getting to herd immunity. So you need to do it and take one for society or take one for the team. I think please lay off, allow people time to process and make their own decisions. Please don't be that person. Allow and respect everybody. Just as we respect those who take the vaccine, allow those to take time and process the information and allow. So it's all about respect and individual's decision. Shukran for giving us of your time. I know you are very, very busy. Your patients need you. So we so appreciate this time in this conversation. And I'm definitely going to take you up on your offer that maybe from at various intervals we can connect. And yes, you might come on and say you've read research and your position is definitely now backed by this research or this data or this results. Jazakallah, Dr. Naseeba Kathrada.
Before I go, I just want to say to the viewers out there, there's lots of data coming out of Israel. It is the most vaccinated country in the world. Go and have a look now how they've now instituted a third vaccine because they know that the two are not protected. Look at that because lots of data is coming out of Israel. The second thing I want to say is let's agree to disagree with dignity and respect because that's what we can afford each other. And remember, don't label something misinformation unless you can say 100% sure that that is false. And until then, we are all must be engaged and open to engage in robust discussion because we want the same thing for each other. May Allah Ta'ala guide us and protect each and every one of us to make the right decisions on a daily basis about this and about everything else in our lives, inshallah.
Jazakallah. And I'd like to acknowledge you on this Women's Month. You are one of those courageous, brave women up there in my books. You are really a courageous, brave woman of our time. And I'm so pleased that we have medical professionals like you who are there to speak out without fear or favor. Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam, jazakallah.
We're going to take a short break, and then from one brave female to another senior brave female, we're going to be speaking to Penny Stain from Making a Difference Initiative. All this after the break.